The keto diet, it is supposedly a miracle for your health, according to some. According to others, however, it is a recipe for health disaster. So, what is the truth when it comes to eating a whole lot of animal proteins, but not a whole lot of vegetables, carbohydrates? What's really going on here? We're going to unpack all of that here tonight. Joining us is an esteemed panel of clinicians, physicians, just amazing human beings who study this stuff for an absolute living. And this is what we are going to do tonight, is to bestow that knowledge with you. First of all, joining us is the founder and medical director of Montgomery Heart and Wellness. He's a fellow of the American College of Cardiology with a primary clinical interest in nutritional lifestyle interventions for the management of chronic illnesses. A fancy way of welcoming Dr. Baxter Montgomery to the program. Thanks for being here, my friend.
Thanks for having me.
Looking forward to getting your insight. And then also a gentleman who I just met earlier this evening, but I'm already in awe of his knowledge. He has studied this thoroughly inside and out. He holds a PhD in chemistry with a concentration in nutritional sciences. He specializes in research in the roles that plant-based diet play in targeting cardiovascular diseases. He is also the co-author of no fewer than 17 manuscripts and 22 peer-reviewed abstracts. With that, we welcome Dr. Rami Najjar to the show. Thanks for being here, my friend.
Thank you for having me, Chuck.
And next up is a good friend of mine. He is the chair of the University of Louisville Department of Medicine, the past president of the American College of Cardiology, also the past president of the American Society of Nuclear Cardiology, and the former chairman of the board of directors of the Association of Black Cardiologists. He, too, is a wealth of information. With that, we welcome Dr. Kim Williams to the show. Thanks for being here again, Dr. Williams.
Thank you for having me.
And last but not least, all the way from Atlanta, Georgia, is a physiologist and doctor of pharmacy. He is the author of Vegetation Over Medication. And now, instead of filling synthetic prescriptions, he uses plant-based foods, medicinal herbs, and simple holistic techniques to help others restore their well-being. Dr. Bobby Price, it is a pleasure to have you with us here this evening.
Yeah, it's an honor to be with you guys tonight.
All right. Dr. Montgomery, I want to start with you because, when I think about the old 420-pound me, if you would have come to me as a doctor, no less, and said, Chuck, you can eat all the meat, all the steaks, all the pork chops, all the bacon you want, that is your key to regain your health and lose that weight, I would have said, Doc, you have just written me a prescription for heaven. But, it seems like what my mom would say back in the day was too good to be true. And she always taught me to be skeptical about things that seem to be too good to be true. Yet we do have literature, published literature recently, saying that the keto diet is absolutely the ticket to not just weight loss, but even a healthy heart. What's the truth here, man? What's going on, Dr. Montgomery?
You see a fair amount of this data, and we're going to get into the article that's published that we'll be discussing. And frequently, when you look at this, these articles, if you will, there's more conjecture, there's more theoretical discussion about the potential of these diets working. I see very little clinical application of this diet, and that's where the rubber meets the road. Science, you have to look at things from the perspective of you have to look at the biochemical aspect of a treatment or intervention, if you will. In other words, does it make biochemical physiological sense? So that's one level. Then the next level is, does that application of whatever that treatment or intervention is, does it meet a favorable outcome, a favorable clinical outcome that matches with that underlying theoretical biochemical physiological effect that it should have? And then at the next level, can you show widespread benefit? Oftentimes you use randomized controlled trials, and then the randomized controlled trials then have to be brought back to the bedside, if you will, and have to be shown to be clinically applicable over a long period of time. So there's a heavy lift for an intervention, whether it's a medication or surgery or the like, And in this case, we're talking about a nutritional intervention. So typically what we see in individuals who talk about the ketogenic diet, the theoretical discussions in terms of how the diet could work, but you rarely see clinical application. And so we're going to discuss some of these aspects. And I think that's something that, we have to keep in mind. And I like to share this with the audience. We should keep this in mind when we're looking at these studies. Is it a theoretical discussion, or they're showing a true clinical application either in the research setting where it's a clinical trial, or in a clinical application where you're showing positive findings?
All right, Dr. Najjar, let me pivot over to you. I've actually just pulled up this study here, and I want to just kind of highlight a key portion right at the top. And we're talking about the ketogenic diet here. It says they also have beneficial effect on the function of vascular endothelium, including improving its function and inhibiting premature aging. The ketogenic diet has a beneficial effect on blood pressure and other CVD risk factors, among others. Weight loss. The evidence cited is often superior. So Dr. Montgomery was just talking about theoreticals, but this particular article in question here says the evidence cited is often superior to that for standard diets, making it likely that the ketogenic diet shows advantages over other dietary models in the prevention and treatment of cardiovascular disease. All right. So before we get into keto much further, let's look at diet and cardiovascular risk overall. All right. So cardiovascular risk, Dr. Najjar, let's carve this up like pie. How big of a piece of the pie is diet going to be?
In my view, diet is the primary determining factor. I believe the American Heart Association states that it contributes 70% of overall cardiovascular disease risk. I'm of the opinion with a diet, especially that is plant-based, whole food plant-based, that can really contribute to a lot more than that 70%, that it can really, because as we've seen clinically based on some studies, Dr. Montgomery, I've co-authored as well as others in the literature, it's been demonstrated to reverse atherosclerosis, improve heart failure, etc. So in my view, it is the primary determining factor, more so than any other factor. Of course, all other factors play a role, but not nearly as much as diet.
So let's dissect this a little bit further then, now talking specifically about keto. Again, extrapolating this sentence from that particular article, says among other aspects, it has a beneficial effect on the blood lipid profile, even compared to other diets. So here's my question to you. How are they arriving at this claim that a diet that is rife with cholesterol, we know that animal protein, steak, bacon, pork chops, you name it, is just loaded with cholesterol, yet we're talking about in this article a theoretical positive impact on your blood lipid profile. How are they arriving at that conclusion?
The conclusion is honestly amazing. I was furious when I read this article because it is incredibly misleading. I went through many of the citations that they cited, looking through the methodology, how the studies were conducted, the results. And what essentially they did is they looked at studies in which individuals in these studies were very much obese. And then what they did is they had them restrict calories and then go on a keto diet. So it wasn't just eat keto ad libitum or energy match keto. It was cut calories, now eat keto. And they lost weight, obviously. And they even claim in the text, they even say this, likely at the behest of reviewers, that a balanced diet that cut calories would have likely the same effects of keto, but that's lost in the text. And the conclusions do not illustrate that, they don't convey that whatsoever. So it's extremely misleading. Essentially, they're just having people cut calories, then eat keto, and they're saying, look how much weight they're losing. And so they're claiming it's the best diet out of all of their diets. You read that in the abstract. It's the most superior diet in eliciting body weight reductions, when that's just not the case based on how they summarize the papers. It's just simply not true.
And Dr. Montgomery, let me come back to you here for a moment. Let me read another little excerpt from this. It says it shows strong anti-inflammatory and cardioprotective potential, which is due, among other factors, to the anti-inflammatory properties of the state of ketosis, the elimination of simple sugars, the restriction of total carbohydrates, and the supply of omega-3 fatty acids. So I want to focus for a moment on the inflammation aspect of this. You and I have talked ad nauseum about the inflammatory properties of animal proteins and a high-fat diet. Yet when we're talking about the keto diet, which has both of those things, fat and animal proteins, just in spades, they're talking about anti-inflammatory and cardioprotective potential. Again, help us understand how we're, arriving at this particular conclusion.
Again, you have to, when you read the article, there are words like potential and words like likely. And so, you sort of read that in between the lines where they make this bold statement and then they come and say it's likely, but I'm not seeing, the evidence where they do that. We have, and I think I can share with you some of our data and this is work that Rami and I worked on a number of years ago, and I think him and his group in Chicago has similar data, where we show a reduction of 30% of C-reactive protein, and this is just 4 weeks. Now, these are patients whom we're removing from the standard American diet. So granted, it's not a keto diet per se, but it's keto-ish, ketogenic-ish in the sense that it has a significant amount of animal protein. And we've been seeing this 30% reduction in just 4 weeks for 2 decades. I mean, this is just one published article, but I look at my clinical data of seeing patients in our center, and we see a 30% reduction. This is an average reduction. An individual, we can see it, 67% reduction in some individuals. So this is a defined plant-based diet. Inflammatory markers and the white blood count goes down, which is another sign of inflammation. Even though the white blood count started normal. So you clearly see a situation where in the clinical application in patients who are coming in, and this group of patients were not acutely ill, but I have groups of patients who are acutely ill, congestive heart failure. They're on inotropic drugs, and we put them on a defined plant-based diet, and we see very rapid reduction in inflammation. So this is what I was talking about before when I say you have to show clinical application of this intervention to show its effectiveness. And of course, you want to show it in large randomized trials as well to show a broader extrapolation. But the data I showed you had very statistical significance with these patients being used as their own control. So there's clear evidence in terms of the effectiveness of defined plant-based diet. And these are people who are removed from an animal-based diet. So you have to look at, if you lump ketogenic diet as an animal-based diet, and I know they make an argument for the fact that they're removing processed carbohydrates, and I think that's probably the one favorable thing about the diet. However, the animal protein is contributing to a major adverse impact on the individual's health.
And if you're watching right now and you have a question for our panel, go ahead and post that in the comments or in the chat. We're going to get to as many as we can here in just a moment. Dr. Williams, let me come to you and let me pull out yet another claim that was in this article and get your opinion on it, where it says the ketogenic diet has beneficial effect on blood pressure and other CVD risk factors through other aspects, including weight loss. Once again, I find it kind of surprising that a high-fat, high-meat diet would have a beneficial impact on blood pressure, because God knows I ate my fair share of steaks back in the day, and I was put on blood pressure medication when I was just 13 or 14 years old.
Wow.
The claim here, I mean, is blood pressure just going to go down automatically if a person has lost a little bit of weight? Again, this is kind of puzzling to me.
So it does. And the interventions that we've done, similar to what Dr. Montgomery and Dr. Najjar have done, if you are able to lose weight, the blood pressure will go down. Your vascular resistance goes down. That's great. But what I really want to warn everyone against is looking at short-term outcomes. And that's the major problem with this study, is that they were looking at, if you look at biochemical markers inverted as they were, and when they try to review the data and they put it all in a table, and they're claiming in the text that it doesn't raise, it's not dyslipidemic, that's not going to raise your LDL, and then their table says that it does in several of the studies that they were looking at. But if you can give me 3 minutes, I'll, if you know me, I have slides. And so, so let me take over the screen just for a moment. Okay. And let's see. Yeah, it's supposed to actually just come up.
It's supposed to.
Yeah, it's trying to get me to pick one, and the one that I need to pick isn't. Oh, it's a Chrome tab. I see. So I will actually pick a window. Okay, and so share screen, a window, and it is Microsoft PowerPoint. Okay, sorry for that little delay. The rest of the delay is not me, but when I'm doing this in Teams, it typically takes about 15 seconds. Okay, can everybody see that?
We cannot. And it's loading.
Here it comes.
See, we've been operating in theoreticals all show long, and this is no different. This is just theoretical technology.
All right,
supposed to be working. We still can't see anything just yet.
You can't see the because it says I can stop sharing, but so you're not seeing my my slides?
We are not seeing your slides at the moment. No.
Let's see here. I'm going to remove. I'm going to end my. Let's see. I'm going to remove mine.
Okay.
And maybe give you room. There you go. So probably had just too many screens on there. Now I see a screen for you.
You do? Does it say ketogenic diet? This is going to give you some scientific background.
It's blank though. You probably need to click one in your window.
Okay. Yeah.
Again,
it's supposed to actually allow me to choose which window to present. And I can try.
I think when you go to share screen, you probably need to go to window.
Share screen.
Then go to window.
I did window and then Microsoft PowerPoint.
Oh, okay.
And if that doesn't work, can you see it now?
It's getting close. I think it's warming up. Hold on.
It's thinking about it. If you're watching this right now and you are familiar with this operating system, please let us know what we could be doing.
Well, there is another option, Chuck, and that is to just share the whole screen. And then it's just that, if my kids text me, I don't necessarily want it to go across to everybody.
Those funny memes. Yeah, man.
So you're not seeing it?
No, it's blank.
So I'm going to go with present and share screen. And entire screen. Share.
There we go.
So you should see yourselves.
Momentarily, perhaps.
Oh, okay. So it says try capturing a different screen to see if this continues. Okay. Oh, it will not share this screen. How about this one? Can you see that?
Bear with us. I appreciate you guys hanging in there. I see that everybody is active in the chat right now, which means that a lot of people, no surprise here tonight, gentlemen, are very much into the idea of keto diets.
In the meantime, Chuck, if we could, I wanted to point out, you mentioned in that abstract, they talked about the beneficial effects of a ketogenic diet. And if you actually, Chuck, can pull up that article just for a second.
With this,
scroll to the first figure that they have. Sorry to put you on the spot here.
Yeah, it's all good.
So this figure right here, you can see all these beneficial effects which they proclaim related to the heart, the endothelium, the blood pressure. Almost all of these studies are based on ketone supplementation, not even in the context of diets, especially with respect to the heart and the endothelium. Extremely hypothetical, or in the case that we just discussed, extremely flawed designs to make these conclusions. And if you could pull up the slide that I had sent you prior.
For sure.
So when you consume a very animal product rich diet, you get a much more, to simply say, okay, blood sugar is down and you get ketone bodies. Okay, these are maybe of some benefit. However, you ignore all these other things that come along with the ketogenic diet. For example, endotoxins, which are found in animal-based foods. You have a propensity for LDL to become oxidized. You have increased, not just saturated fat is not just bad for increasing cholesterol. You actually get an increased content of free fatty acids in circulation. So more fat is in your blood. And this is extremely detrimental to the endothelium. You can put people on an Atkins diet, essentially ketogenic diet, very high meat, almost absent carbohydrates. And the aortic stiffness that they experience is the same that is experienced in obesity, that is the same that is experienced when people are infused with lipids. When fat is infused in their blood, they have the same aortic stiffness that occurs. And researchers have looked at the effects of infusing lipids into the blood, and they found that endothelial function, the function of the arteries, are reduced. And they also find that you get an increase in the renin-angiotensin system. And people with blood pressure, and Dr. Montgomery and Dr. Williams, as well as Dr. Price, you're well aware that a lot of blood pressure medications target the angiotensin system. They're either ACE inhibitors, angiotensin receptor blockers. These are the primary medications that are utilized to treat blood pressure. You can actually get an increase in the renin-angiotensin system when you get this increase in free fatty acids in the blood. And very carefully, well-designed metabolic ward studies have been done where they provided people with a ketogenic diet, matched calories with a baseline high carbohydrate diet. And they found that ketogenic diet individuals had increased free fatty acids to the same level as those as diabetics, as those who are obese. And they found increased inflammatory markers as well. And when they provided them the carbohydrate-containing meal, they were severely insulin resistant. So a lot of pathological factors arrive with animal products, which are completely ignored by this article. If you go to this next slide, Chuck, real quick, the way cardiovascular disease is essentially in the postprandial state. After you consume an animal product-containing meal, all these pathogenic factors are increased, and they peak within 3 to 4 hours and then seem to subside by 5 to 6. But at that point, people are already consuming their next meal. So you're in this constant postprandial state of increased inflammation, oxidative stress due to these inflammatory factors that are provided by animal-based foods. And after many decades of this, eventually the symptoms of cardiovascular disease present. However, cardiovascular disease has been developing over many, many years from childhood. So this is essentially how cardiovascular disease develops through dietary means.
So Chuck, I took a page out of Dr. Najjar's book. I sent you the slides.
Okay, good to know.
And you just check your email and bring them up. And the
Chuck,
slides that I'm going to show are because exactly what Dr. Najjar was just talking about. He's giving the mechanism to show you. What I wanted to focus on was really the outcomes, longer term outcomes, and that will be set up by. I understand it better after listening to Dr. Najjar.
And Dr. Price, you've been sitting there, this entire time without saying much. We've been talking, about cholesterol and blood pressure. And I'm just curious, think back to your pharmacy days. Like, how often were you filling prescriptions for cholesterol medication, for high blood pressure medication?
Well, cholesterol medication is the number one medication people are picking up in the pharmacy, unfortunately. And just to piggyback off of Dr. Kim, typically people see these acute benefits like a reduction in blood pressure, but you see that every time that you shift any macronutrient. It doesn't matter what macronutrient it is. If you shift any macronutrient, you dump your carbs or you dump your fat, you're going to see a shift in, some of your vitals. And that's what I think what happens. People get really excited about some of those acute benefits, but they never last.
Let's see here. Dr. Montgomery, we have a comment on the screen. 85% of vegans give up the diet and go back to eating meat. Only 19% of U.S. citizens eat vegan. 19% seems a little bit high to me, to be honest with you. I'm not sure where
I was
that's.
starting 10%. Yeah, I wanted to bring that out. There are a few other pro keto comments that I didn't want to go by, and people are nice enough to comment. When people go from a vegan diet back to eating meat, it doesn't mean that that's a healthier diet. I mean, a lot of people start exercising and they stop exercising. Doesn't mean that the lack of exercise is healthier than exercising. People are addicted to eating meat in the standard American diet. So when people, get off any unhealthy food that they're addicted to, they'll go back to that unhealthy food, whether that's, cheese or eggs or bacon or beef or pork or donuts. And so, I want to address that comment because 85% of vegans give up. It's a comment that's taken out of context, and if someone will see that in the chat, they'll say, "Whoa, that maybe the vegan diet is intolerable, unhealthy." No, we're looking at a society that's addicted to certain foods, and when you go to a healthy, plant-based diet, it can be difficult to sustain, especially in an environment where people around you are eating, animal protein foods predominantly. You go to barbecues and go to church events and family events, and it's always something that has dead animal flesh on the menu. So there's a lot of factors that contribute to that reversion off of a plant-based diet. And it's not just the fact that the plant-based diet doesn't improve cardiovascular disease. In fact, I see lots of patients come and say, "Well, yeah, I'm doing great on the plant-based diet, and I just got off because whatever reason, and I couldn't sustain it because my family eats meat or whatever. I'm addicted to meat."
That family pressure, that peer pressure, man, that is like really, really intense. All right, Dr. Williams, I have your slides here.
Oh, fantastic.
I'm gonna go ahead and pull these up. And so you just tell me when it's time to flip over to the next one.
I will, but I have to comment on to agree wholeheartedly with what Dr. Montgomery just said. So actually, we're in the middle of putting together a manuscript entitled "Chatting with ChatGPT." barriers to optimizing nutrition. And so we had just published a couple of weeks ago the physician survey at Rush and Loyola showing that there was one plant-based doctor out of 274, and the vast majority were eating an unhealthy American diet. And out of frustration, I started discussing it with ChatGPT. The question on the table was, if the adoption of a plant-based diet is capable of lowering death rates, lowering chronic diseases, helping to sustain the planet, and avoids animal cruelty, why are they not widely accepted? And Dr. Montgomery, you scored pretty high on the ChatGPT list. That is sort of a game I play with any big deal. I ask ChatGPT and see how many times it's going to get something that I didn't say. But it was resistance to change, convenience and time constraints, emotional attachments, lack of education, marketing and industry influence, social norms and peer pressures, nutritional concerns, which are unfounded, accessibility, affordability, taste and familiarity, and most important, listed number one, was cultural and traditional habits. So this is what we're up against in trying to get the American population to be more healthy. So thanks for that digression. So if you show the slides, and I'm going to give you a crash course on the keto diet. So that's I don't think that's in presentation mode, because it actually starts with the keto diet, and then Atkins' picture comes up, and then the lady. So are you able to show it in PowerPoint, or this is the way it goes?
Let me see what I can do here.
It's all right, because it's just that I use a lot of overlays. So this is an overlay. So if you could.
I see.
What, and while he's looking for that, I don't know, Dr. Najjar, Dr. Price, can y'all see the chat comments in the chat or not?
No. Let me see here.
Okay.
So if you click on comments, then you should be able to see it. So Chuck, can you try up arrow?
Yep, I got you covered here, my man. What I'm going to do here is you're just going to have to cue me, because I'm going to be flying blind for a second while I share my screen to make this work. So whenever you need me to click over to the next slide, you just let me know.
Will do.
And here we go.
It's coming.
It is coming. I promise you. This time it really is. I promise you. We're not making this up. All right. Going full screen here. All right. Here we go. Can everybody see that?
Not yet.
Unfortunately not.
No, I just see all of us.
Oh, for
You
the
got
love
the
of
same
Pearl.
problem that I
Add to
had.
page.
How about
Oh,
now?
there it is.
There it is.
All right.
So now, there you go. All right, very good. So that is the ketogenic diet. All right. So if you advance it, please, you're going to see a picture of Robert Atkins, who started this, has still a very large fortune. There have been lawsuits about what I'm about to talk about against his. He passed away quite a while ago, and they say it was cardiovascular, but I have no proof of that. So that's just a rumor. But the biggest problem that I see with the ketogenic diet is shown if you hit the arrow is that it works, and you're going to see some massive weight losses, and associated with that, you're going to see the fall in blood pressure, you're going to see the fall in insulin levels, and insulin sensitivity improves, and improvement in blood sugar. Okay, but if you advance it, you'll see that starting almost 20 years ago, there were concerns about this. This is actually from Greece and Harvard School of Public Health, talking about long-term survival. That's what I hope everyone is looking at. When you make choices, maybe we should be putting the planet first, but we certainly should talk about long-term survival and long-term outcome. Next slide, or next advance. Yeah, and so what the Greek authors said that there was a 22% increase in mortality long-term if you followed people who were put on an animal-based, animal protein diet. Next. So this is from Japan. So in case you think, oh, it's just Americans have bad eggs. We've heard that one before. Americans have bad meat. This was from Japan. It actually showed exactly the same thing. Next, and the overlay, they actually put their data along with others and came up with, by a meta-analysis, a 30% increase in mortality. Next. So then along comes Sarah Seidelman, who's a wonderful cardiologist and biostatistically speaking, looking at the ERIC trial and their outcomes, 15,000 patients with diet histories, and some stunning results that were published in Lancet. If you go forward, please. That what I had never heard of before, you see in green, that you can actually do a low carb diet with plants.
Yeah.
Okay. But if you do it with lamb, beef, pork, chicken, you get a higher mortality. So next slide. How bad is it? 18% increase in mortality overall. But if you do it with plant-based, that 0.82, that's an 18% decrease in mortality. So next slide. And that is and this is why you get a different number every time you look at one of these studies, something 13% increase in mortality, 70%. It's because it's a continuous variable based on how keto you go. And notice the other side of it, by the way, the high carbohydrate diet. What's wrong with carbohydrates? People, there's nothing wrong with the plant, but when you take a plant and put it in a plant that is a factory, and you come out with a processed grain on the other side, that does increase mortality. Maybe not as much as eating a pure animal protein diet, but it does increase mortality. So she was saying the optimum is about 50% carbohydrates, but I think it's more insight than that. You don't want to eat a lot of animal products on the one side, and you don't want to eat refined grains on the other. Next. So if you look at all of the groups and this is sort of the ERIC study plus the meta-analysis, you end up with this idea that you're going to see much more in the way of mortality when you do the lower the carbohydrate. And so these hazard ratios, 15, 75%, 12%, they're all up there. There is no low carb data other than the plant-based one where it's ever been shown to be safe. Next, if you will. Okay, and this is even worse if you do a high versus moderate carbohydrate group for the reasons that we stated. Next slide. Okay, so this is actually data about animal sources, and I could have chosen probably one of 50 different articles that we've looked at. But the fact of the matter is, whether you look at COVID, chronic kidney disease, heart attack, stroke, we can just run through the data of heart attack survivors. The more animal protein you eat, the worse the outcome. And so this one was really remarkable because it said that the low carb diet, if you had had a previous heart attack, and we've seen people try to have a heart attack, get revascularized, someone tells them to go on a keto diet to lose weight. And this is what happens. It's tremendous burden of mortality. Next slide. So 51% increase, or 53% increase in cardiovascular mortality. Very few things can do that. So this is really important to make sure that if someone's going to mess around with it, they would have to do it for a short period of time, be sure that they don't have coronary disease, and certainly be sure they don't have a prior heart attack. Next slide. So this is the data that completely, I don't know how the authors of that article, Dr. Najjar, thanks for bringing it to our attention. Thanks for responding to it. I'm not sure what they were looking at. There's very clear improvement in glucose metabolism, but the lipids and the inflammation go badly when you eat animal products. Next slide. And so that increase in cholesterol and inflammatory markers, those are two of the three big things that we know are associated with progression of coronary heart disease and bad outcomes. That's TMAO, trimethylamine N oxide, which is almost exclusively derived from eating red meat and animal protein, okay? Inflammation and LDL cholesterol. Next slide. And so they've taken a very careful look of before and after baseline diet, keto diet, and you see some improvement if you're looking only at glucose and insulin levels. But the fact of the matter is your interleukin 6 is going to go up. Your C-reactive protein is going to go up. And this is not the kind of thing that you would want, particularly after the residual inflammatory risk was published in March in Lancet by Paul Ritker. You want to do everything you can to avoid inflammation. Next slide. Okay, this is the lipids showing exactly what you expect would happen. And you see the argument in that article talking about how, oh yeah, the LDL goes up, but it's a more fluffy LDL. So it's not small, dense LDL. Well, that would be great if that was not atherogenic. It may be less atherogenic, but it's still atherogenic. And, you know, these are averages. Fact of the matter is you'll see some people whose LDL actually triples if you see enough of these patients clinically. Next slide. I think we're getting to the end of it. So I want them to argue with our National Lipid Association. Okay, they put together a task force specifically about this. This is, you know, Chris Atherton and Carroll Kirkpatrick and Karen Ashby. These are gurus of, you know, of nutrition. They've given their life to this, and they reviewed all of the literature published in Journal of Clinical Lipidology, and the conclusions are exactly what you would expect. You're going to improve your weight, improve your short-term risk, except for the inflammatory markers and the glucose, and you're going to pay the price for those going haywire down the road. Next slide. This was the summary of basically what I said. And, you know, it's great if your triglycerides go down because you're not eating fast carbohydrates, and your hemoglobin A1C goes down, blood pressure goes down, weight goes down. It's all looking really good, except the LDL increase and the inflammatory marker increase out in the long term outweighs any metabolic benefit. I think that's pretty much the last slide.
Dr. Williams, you know, the reason they left all these studies out is because they had an agenda. I mean, exactly. It's so compelling and obvious. You know, this is very convincing, like regarding epidemiology data. And the previous study you showed, it was the same study that highlighted the insulin resistance that these individuals experienced on keto, as well as elevated free fatty acids. And obviously, there was a major agenda with writing that paper. They had a clear slant.
Very clearly with, you know, selective journalism, let's call it. it sounds a little less nefarious than it probably was. So the rest of the slides were just convincing you that you shouldn't eat animal products because it's going to hurt your heart and kill your body. If it wasn't for that,
I've got a comment on some of the acute aspects of it, and I appreciate that, Dr. Williams. But I saw this in the chat, and Dr. Price, you're an herbalist, and Jan Smith talks about healing powers of meat, and meat equals tons of vitamins and minerals. What can you help her out?
I can't actually. I can't help her out. But if you look at a lot of the long-term studies, they did a ketogenic diet study even with pediatric children. What they noticed was that even with them, there was inadequate intake, or being able to get 17 different micronutrients. Everything from calcium, the phosphorus, the magnesium, iron, zinc, they were deficient. And in one case, they had a child that even developed scurvy as a result of going on a ketogenic diet. Mm-hmm. Now, I can't necessarily refute the benefits of possibly having less seizures, but you have to understand that there's also, sometimes there's two things that are true at the same time. And what I've noticed is that that's exactly what it is with the ketogenic diet. One part of it is true, is we do need to lower the unhealthy forms of carbohydrates. But on the other end of it is increasing the amount of fat and protein that we eat is going to lead to, malnutrition at some point. And like I said, one of the children developed scurvy. Another child died as a result of having a deficiency in selenium as well, too. And so the idea that you're going to get any of these nutrients specifically from animal-based products, especially in the therapeutic doses that children or adults even need, I really can't answer how could that be.
I hear this a lot when people purport the benefits of meat. It's like, oh, they have all these minerals and et cetera, and at the most it's secondhand. And whenever you do nutritional comparison, you see a lot of these micronutrients and minerals are much higher in plant foods. And then you mentioned seizures also, which is another commentary that was mentioned briefly in this article. And I've heard people online talk about the benefits of a ketogenic diet in treating people with intractable seizures. We've actually successfully treated people with seizures. One patient in particular that comes to mind, she was having, better part of 10 seizures a week. And she was on 3 or 4 anticonvulsant medications. And she was doing our boot camp. And what we did is I liberalized the amount of seeds, avocados, and even nuts that she had. So she was probably on a higher fat diet, but the fats were all raw and they're all plant-based. And we reduced the number of seizures down drastically. So you can do this with the defined plant-based diet also. And these patients tend to need a higher fat diet, but the fat doesn't have to be from animal protein. Yeah. And the other part about the long-term versus short-term, and I agree with Dr. Williams about, you want to look at the long-term benefits. But those of us who are in the trenches, treating these acutely ill patients, when you're at the bedside, nutrition can have an acute favorable intervention in people. I've treated them in the ICU, CCU, the cardiac unit. They come into my office, decompensated heart failure, and I can use a raw detox diet as an acute intervention. Yeah. And you can see them turn around quickly. I've had a number of people on hospice giving up. I've weaned people on milrinone on an acute defined plant-based diet. So there's a place for the acute intervention. I guarantee that you cannot, show this kind of an acute intervention in acutely ill patients on a keto diet. You can have people who are relatively healthy who has margin for error. So if someone's overweight, they're not acutely ill, you can show some benefits over a short period of time because that person has margin for error. So all the bad things you're doing with the keto diet is not taking an effect. But someone who's acutely ill or nearly acutely ill, they have less room, less margin for error. And so these diets can be harmful even in the acute setting. So I would dare say, at least the studies I've seen or reported on in the keto diet are not in people who are clinically ill. And so somebody with coronary disease who may have an unstable plaque and get on eggs and bacon, etc., fried steak, you can cause plaque rupture and have acute event with just 1 or 2 meals. So these diets can be very dangerous, even in the short term, even though, yes, you can see short-term benefits, but these short-term benefits are likely shown in people who are not acutely ill.
And if I may, regarding the short-term benefits, Dr. Williams, you showed in your first slide how efficacious it was in reducing body weight. The National Institute of Health actually conducted their own study internally, a metabolic ward study, in which they took people on a very low carbohydrate ketogenic style diet versus a high carbohydrate, up to 70% carbohydrates, and compared the two. And they consumed about 2,000 calories each. And what they found was those on the low carb diet actually lost more body weight, but it was actually the low fat diet lost more fat mass. So the keto diet group, or the low carb group, I should say, was essentially losing lean mass. And they found that calorie for calorie, fat restriction results in more body weight reduction than carbohydrate restriction. About 38% more calories are reduced with fat restriction versus carbohydrate restriction. And that was a very carefully designed metabolic ward study where they kept people in-house for almost a week, looking at energy expenditure and such. So I would reckon that a plant-based diet, whole food plant-based diet, high in carbohydrates versus a ketogenic diet, you'd probably see more efficacious weight loss in the plant-based diet that's higher carbohydrate based on those results.
Yeah, and I like to emphasize a minimally processed plant-based diet because a lot of people are frying their stuff and grilling and microwaving. So what you do to the plants, I think, is important as well. Anyway.
Dr. Montgomery, why don't we get this question? It's up on the screen right now. I find it kind of interesting. It's kind of screaming your name to me, honestly. It says, we absorb iron in meat much better than vegan foods, ! So you know they're serious about making this point.
I want my colleagues to comment on heme iron, so I think...
Oh, Dr. Williams, I saw that hand go up.
Yeah, no, he got it. It's that heme iron is actually toxic. So whoever put that in, I don't see it in the chat, just please do heme iron and mortality, and you'll see that the I think it was NIH AARP study that showed that maybe that we're overdoing it when we talk about saturated fat or TMAO or cholesterol from meat. Maybe it's the heme iron.
And how would one go about eating a plant-based diet, say that we've piqued their interest tonight? How would somebody go about making sure that they're getting an adequate amount of iron if they're getting it from a non-heme source? Dr. Williams.
So it's really important to recognize that the leafy green vegetables have a lot of iron, particularly spinach. But there is an association, and I bet it's because of that heme iron creating oxygen-free radicals and upsetting plaque. There is an association between serum iron or serum ferritin levels and the degree of myocardial infarction. That was a Finnish study many years ago that first pointed it out. So, we think that younger women don't have as many heart attacks because they are younger and female and estrogens, but they also run a lower hemoglobin level, lower iron levels. This is the NIH AARP study talking, not so much me.
Dr. Price, again, you're kind of sitting there, man. I see. Let me peel back the curtain and let you guys know what's happening right now. This is Dr. Montgomery really going after the people who are coming hard tonight. So I don't even know. I mean, Dr. Montgomery, you pulled it up. You comment on this one. This is next level, man, to be honest with you.
So one of our, and then we want to invite the commentators and the people in the chat, but someone's gone political on us. And so Bill Gates is pushing this vegan diet movement because he has invested in a new warehouse veggie growing industry, chemicals, And so there's a lot of talk about that. We're not talking about, and I think I speak for my colleague, but I'm certainly not talking about a so-called vegan movement from a political standpoint in the absolute sense. I came into this arena strictly from a health perspective. Now, there are a lot of things to be said in terms of about environmental benefits and the like, and I think those things are all important. What this discussion started out with purports of a ketogenic diet having cardiovascular benefits, which has not been borne out to be true, and certainly clinically it's not been borne out to be true. And then that's primarily, and then secondarily, the overall health benefits of a plant-based diet. So you can talk about, Bill Gates pushing the vegan movement and the like, and so on, and there are other political statements that can be made. But I brought this comment up because our discussion is purely based on scientific evidence, clinical evidence, based on individuals' benefit. And I would even go far and say that I don't even advocate that my patients eat these processed vegan foods that are chemicalized, Beyond Burger, et cetera, et cetera. So I'm not a fan of just anything that's called vegan. It has to be minimally processed, healthy, natural, fresh, et cetera. We have our patients eat a predominantly high raw diet, food that's minimally heated or eaten in its natural state for the most part. And if it's cooked, it should be steamed and boiled. So there are different characteristics. We also recommend that your grower, grow your own food as much as you can, get locally grown, sustainably grown food. So there are many aspects of healthy eating. So it's not just a matter of vegan, chemicalized vegan foods, et cetera, because many of these foods can be very unhealthy. And I saw that in the chat, and I wanted to highlight that because that may be on the minds of lots of individuals. And this is certainly not what we're talking about.
Yeah, and I think most importantly, what someone mentioned in the chat is it's so important where you source your food from too. And so one of the people mentioned in the chat, well, you should start growing your own food because the benefits of plants are never going to go away in terms of like the original form of plants. And the spinoff of the question that was asked before about the iron, I think there's a lot of factors that play into iron too, not just the issue of whether it's heme iron or not. It's also important about how unhealthy our population is too. A large percentage of the population doesn't have enough stomach acid. And because they don't have enough stomach acid, they can't cleave the R protein off to actually get the benefits of vitamin B12. And sometimes they'll end up with issues like H. pylori as well too. And those type of things tap into a lot of your minerals and nutrients as well too. So I think a lot of times people are trying to solve the issue by looking at maybe the problem instead of the solution. And so I think it's really important we understand that at the end of the day, the vast majority of your not only your micronutrients are going to come from plants, but most importantly, they're going to come into the body in the least form that is most difficult to digest as well too, as opposed to eating meat and a lot of other animal products.
Let me stick with you here for a second, Dr. Price. Let's say somebody has been watching tonight. And they're like, okay, well, yeah, the keto diet, what's not in dispute is it will help you lose weight. And there is a pill for every side effect that comes with the keto diet, all the nefarious stuff these guys have been talking about. What would your message be to that person who's like, I just want to lose weight and I'll pop the pill for everything else and be good with it? What would you say to that person?
I always tell people the most important thing is to get healthy and then you'll lose weight. People are trying to lose weight without thinking about getting healthy. If you're healthy, you're going to lose weight. And the most important equation to being healthy, or one of the most important factors, is what you put in your body. And so at the end of the day, it's going to be a combination, of course, of what you eat. And I don't know any population of people, and I've lived in 2 different blue zones, and the one consistent factor that I see is the foundation of a plant-based diet equals not only a longer life and a higher quality of life, but it also leads to a leaner body as well too. And so I just think it's really important that people sort of start to embrace some of those old principles and do the work that is required to actually get healthy, and then they will naturally just lose weight.
Dr. Montgomery, I would love to come to you too. In your clinical practice, I'm sure that you have encountered patients who have that mentality. What has your messaging been with them?
I simply say people are not sick because they're fat because they're sick. And I echo the comments of Dr. Price that you have to go toward getting healthy first and foremost. Patients with malignant cancers lose weight. Patients with other types of chronic illnesses will lose weight. So, weight loss isn't the sine qua non of health. It's optimal health is in and of itself optimal health. In fact, when I see patients coming into our clinical practice, I, in a way, to a certain extent, ignore their weight. Now, I may see someone who's morbidly obese, and I may see someone who's very thin, and they may have similar diagnoses. They may have type 2 diabetes, they may have high blood pressure, or whatever they have. I will treat them with the same nutritional intervention. And it's not about weight loss. Now, the person who's very thin will complain about the weight loss, and the person who's very heavy, will be excited about the weight loss. However, it's about nutritional cleansing and healing. It's a biochemical process. And so it's correcting the body, getting the body biochemical balance and physiological balance. That's really important. When you do that and you remove toxins from the system, because people have to understand you're collecting fat cells and you're retaining fluid because the body has to store a lot of these free radicals and all these toxins. You may have intracellular fat. You may be storing free radicals and toxins and denatured proteins because the body is toxic. So these fat cells are fluid collections are sort of like waste bins so that the body can push the toxins away from the normal cells so the cells can function. So when you allow the body to remove these toxins, you allow the body to get into biochemical physiological balance, then the fluid comes off and you can also reduce fat. So it's a process of healing first and foremost. And then the body's going to do what it needs to do from the standpoint of weight loss, from the standpoint of cardiovascular repair, from the standpoint of metabolic balance, from the standpoint of enhancing the immune system, whether you're fighting cancer or fighting COVID. Whatever it is, the body's going to do these things at a much more effective way when it's biochemically and physiologically in balance.
All right. And as we start to wind down here, Dr. Najjar, just to poke the bear, the proverbial bear, one more time tonight, playing devil's advocate here, you were talking about that initial study we were discussing, that paper there, and you said that they had an agenda. I think that it's important to note that the authors declared no conflict of interest there. So when a person suspects that there is an agenda behind something, yet there is no conflict declared, how is someone to interpret that?
The reason I said it in this specific case is because a lot of the arguments that I saw in the keto article were things I've seen on the internet, in blogs, by people who are not scientists but speak about science as if they're extremely proficient. So this is in this specific context in why I said they had an agenda. Your specific question related to how to discern if there is an agenda or not, is that what you're asking?
Yes, sir.
Yeah. So I think that organizations such as American Heart Association or other, Dr. Kim Williams discussed the National Lipid Panel. They develop guidelines based on expert review panels who are experts in the field. And these are generally much more reliable than articles that claim the opposite. For example, the American Heart Association ranks ketogenic diets as one of the worst diets to consume. They have it literally at the very bottom of the list in terms of the worst diets for cardiometabolic health. And these authors in this review paper are claiming the opposite. So who do you trust in that situation? Expert review panel from scientists all over the country who are experts in the field, or these authors who are saying the opposite and are reciting old tired arguments that we see. It's kind of, it's not really an equal comparison. That's my opinion.
And Dr. Williams, as we again wind down here, any final thoughts this evening?
Well, I think we've covered a lot of territory. What we really want to focus on is that when we talk about the carbohydrates that people are, they're all not all the same. I know we've made that point. And when people are starting to do vegan, just really responding to what the Bill Gates issue, yeah, there are a lot of unhealthy vegan foods, but you can actually evaluate them. Find out if you are looking at something with saturated fat that's typically coming from curries or coconut oil, palm oil, tropical oils. And there are specific, meats that are become popular, and you know which ones I'm talking about, that have a high amount of saturated fat. But they also, you can look at the sugar content, and you can look at whether or not it's using refined grains. And also sodium. If we avoid those four things, you're basically trying to do a whole food plant-based diet. And I know there's a lot of my friends who are more planetary, animal rights people and the planet sustainability folks, and I agree with them completely on those issues. But going about it with vegan foods that are processed, with the data that's out there says that they can be more dangerous than eating an animal-laden process. So I kind of tease them that it's good for the planet because it gets rid of humans. They don't like it when I say it.
Dr. Price, the floor is yours for final thoughts.
Our bodies are not designed to primarily run on fat. And even when we overconsume fat, it is converted into glucose, which shows you the importance of, carbohydrates. We have to maintain a blood sugar between 70 and 90. And I think it's really important we understand that. Yes, I agree. There are some carbohydrates that need to be eliminated from the food chain, but I also understand the importance of true carbohydrates in the form of green leafy vegetables and, things of that nature as well too. So just to kind of tap into the argument, it's so important that people understand that when you're looking at your diet, it needs to be balanced, it needs to be diverse, and it needs to be plant-based.
There it is. Dr. Najjar, up to you, my man.
I just want to comment that it is extremely, we were actually talking about this before the show, Dr. Price and Chuck and I. The keto diet is a very convenient excuse in my view as well, that excuse to just consume foods such as bacon, eggs, meat, etc., and to essentially convince yourself that it's healthy. But the preponderance of evidence says otherwise. And in my view, a plant-based diet is demonstrated to be more efficacious than any medical therapy, any drug, any other diet that exists in the literature. A plant-based diet is the most efficacious in preventing, treating, and potentially reversing cardiovascular disease. There's not a single study in the literature that shows a keto diet can do this, not even close. And there's no study in the literature that shows that fruits are harmful, which are abstained from the keto diet, whole grains, beans. Every single study, not a single one can be found that shows that these are harmful. These are all unanimously, universally beneficial to health.
All right, and Dr. Montgomery, as Dr. Williams said, we have definitely covered a lot of territory tonight. Is there anything that you want to put a bow on?
Yeah, typically, the argument I will raise, if let's say you're debating a variety of different diets, and let's say, for instance, you got the argument that the 100% plant-based diet is healthy, and then you have others say, well, the ketogenic diet is healthy, and then you say, well, the Mediterranean diet is healthy, and then so on and so forth. The common denominator of all these diets are plant foods. That's a common denominator. And so let's say you argue the ketogenic diet or whatever, because the ketogenic diet have plant foods, and the other diets have plant foods, and they also have healthy plant foods. But there's no diet that can do without plant foods. So the sine qua non of a healthy diet consists of plant foods. That's number one. And the animals you're eating have to eat plants. So the original source of all nutrition on the planet are plant foods. So when you get to a foundational understanding of how, animated, creatures nourish themselves, the primary source of nourishment is plant foods. So it gets to a very fundamental understanding that, plant foods are essentially the ideal foods. So you can look at the science, you can look at biblical scripture, you can look at, clinical evidence. So it matches across the board. And there's a fundamental aspect to plant foods that is essential to all human and creature life. If you get rid of all the plants on the planet, we all die. All the animals die and all the humans die. So it's just as fundamental as that. You just sort of step back and squint and look at the most fundamental aspect of what's essential to nourishing, animated creatures on the planet. What's essential are plant foods. And that's all there is.
All right, gentlemen, we have definitely covered a whole heap of ground tonight, and there's still more to cover coming up next month in Houston at the Montgomery Heart and Wellness Summit. Let's take a look.
Welcome to the Montgomery Heart and Wellness 2023 Health Summit, Nutritional, Integrative, and Regenerative Health, the Future of Medicine. Chronic illness continues to have a devastating impact on the U.S. Sickness and premature death now have dominion and are accepted as normal in our society. The Montgomery Heart and Wellness Health Summit 2023 will provide insights to nutritional, integrative, and regenerative health as the future of medicine. The summit will include internationally renowned experts in the areas of lifestyle, nutrition, integrative, and regenerative health. Workshops will include a live demonstration of an intravenous ozone therapy, a clinical case rounds presentation on how the MHW team utilized integrative health approach. Opportunities to visit experts and gain valuable insights will be had, and access to MHW team members to gain information on our new and legacy programs and the benefits to you. The program will be on November 18th, 2023 at 8 a.m. It will be at the United Way in Houston, Texas, and 50 Ward Drive. Don't wait. RSVP now. Begin taking control of your life today.
And, I would say that we began taking control of our lives this evening. A lot of people who are watching right now really got their eyes open. And so I think today may be, to borrow a phrase from something completely different, the first day of the rest of their life. Gentlemen, thank you again for your time this evening. This has been absolutely enlightening. This has been also a real treat. Thank you so much.
Thank you very much.
Thank you very much.
Take care, everybody.
All right.